Welcome, CTO Demon Channel friends. This is not a core curriculum talk. Some of you know recently I've been working on fluoroscopic 3D wiring. And today I really want to focus on one particular phrase and try to explain it to you. And it's the phrase of Okamura sensei, which says opposite behind, same in front. Now this phrase is the basis of Okamura style 3D wiring. For myself, of course, the last 15 years or so, I've kind of acted as the informal interpreter of the Japanese CTO masters, writing out Tsuzikani and Dr. Kato's techniques in multiple papers and in talks and in presentations. So I'm honored to be able to do that for Okamura sensei, who have become really much closer friend to in the past few months as we work on 3D wiring together. So I really want to explain what he means when he says opposite behind and same in front. It's no shame to admit that you don't understand this, because I know many fantastic CTO operators, and I myself also had struggled with this concept for some time. So the best way to begin understanding this is in the mid right corner in the RAO view. Now, those of you who've done some PCI will know, in the RAO view, when we look at the mid right corner, the spine is on the left hand side of the view, and the sternum is on the right-hand side of the view. What this means is that on the left-hand side in RAO is the back. On the right-hand side in RAO is the front. And this is the principle that Okamura uses. It doesn't require rotational angiography or second view to determine what is in front or behind the target. RAO view, right anterior oblique. Right-hand side is in front. Left-hand side, opposite to right anterior oblique, is behind, is nearer the spine. Now, for Okamura's method, there's 2 points on the wire we need to determine the position of. First is the shaft, and when he talks about shaft, he means the shaft just before the tip bend of the wire. And the second is the tip, and when he talks about tip, he means the tip direction that the tip is pointing at. Okay? And these 2 things are in relation to the center of the target. Now, in this diagram, you can see I've drawn the center of a target as a line up the vessel. And this is the reference line. So in this case, you can see the shaft just before the tip is on the right-hand side of this reference line in the right anterior oblique view. So right and right is same. It means it's in front of the target. The tip is also pointing to the right-hand side of the screen in the right anterior oblique view, same right and right. So the tip is also in front. Now, it makes completely sense to me, because when I'm in RAO, the spine is on the left and the sternum is on the right. So when it's on the right-hand side of the screen, it's going to be in front. Very simple. In this second example, the shaft is on the left-hand side of the screen. So it's nearer the spine. In left-hand side of the screen, in the right anterior oblique view, is opposite, is behind. The tip, however, is pointing to the right-hand side of the screen. In the right anterior oblique view, right and right, same, is pointing in front. And of course, we know the spine is on the left-hand side, the sternum is on the right-hand side. The tip is pointing front, the shaft is on the back. In the third example, the shaft is on the right-hand side of the screen. In the right anterior oblique view, the shaft is in front of the target. The tip is pointing towards the left-hand side in the right anterior oblique view. Left and right is opposite. The tip is pointing behind. In the fourth example, the shaft is on the left-hand side of the reference line. In the right anterior oblique view, opposite is behind the target. The tip is also pointing towards the spine. In the left-hand side, in the right anterior oblique view, it's opposite, is behind. Very clear so far, okay? Now, let's take this example, example 5, the reference line in the center. The shaft is on the right-hand side in right anterior oblique, is in front of the vessel. The tip is pointing to the left-hand side in right anterior oblique, is opposite, is pointing behind. Now, if we rotate to LAO, okay, when we rotate to LAO, what we find is the left-hand side of the screen is the left hand of the patient, and the right side of the screen is the right hand of the patient in LAO view. Okay, and we find now the wire is slightly on the left side, but the tip is pointing slightly on the right side, and the tip is pointing towards the left side. Okay, but we know in this case that the shaft is in front and the tip is behind, which means the wire is near me and then it points away from me. If it's near me and it points away from me, and now in the LAO is slightly pointing towards the left side, okay, it's like this and that. What do I need to do? What do I need to rotate? I need to rotate this way, which is clockwise. So I need clockwise rotation. That's how we work it out. Now, things become more difficult if we go to the cranial and caudal view for distal RCA. So if we're in a distal RCA CTO, okay, and the reference sign now goes across, okay, the corresponding views is LAO 30 cranial 45 and LAO 30 caudal 45. Now, the bigger angles determines the view. So since the cranial and caudal are 45, the LAO is only 30, this is a cranial and caudal view, okay? Cranial view, let's go to the cranial view. What is on the top is the head of the patient. What is on the bottom is the feet of the patient. And we all know this. When we're wiring a distal RCA, if the wire is on top of the target in distal RCA, it's actually on top of the vessel. If the wire comes below the RCA, it's actually under the target. We know this. We know this. It's nearer the stomach of the patient. We know this. But in this angiographic view, we work it out in Okamura language. Okay. So now the shaft is on top of the vessel, so it's near the same. The cranial view is on top. Okay, near the head side. The shaft is near the head side. Head and head is the same. So in Okamura language, this is front or top. The shaft is, the tip is pointing downwards, okay? It's pointing away from the cranial, away from the head. It's head and feet. It's opposite. So in Okamura language, it's behind. So Okamura has a concise phrase. He will call this front back, okay? The first word that he says is the position of the shaft. The second word he says is the position of the tip, front back, okay? Now, if we rotate to caudal view, what happens in caudal view is the top now becomes the sternum, or the light bulb in this case. The bottom is the cath lab table, or the back of the patient, okay? Now, when we turn to this caudal view, we see in this figure that the wire tip is pointing slightly upwards, okay? What this means, think about it. In the cranial view, the wire is on top, okay? As we rotate to the caudal view, like this rotation, the wire points towards the tip, towards the top, okay? So the wire tip we know is pointing downwards. So how do we need to rotate the wire? We need to rotate the wire this way. What is this way? Clockwise. So this is a very simple way of finding out which position the shaft and tip is and to know which way to turn the wire for Okamura style 3D wiring. This is as clear as I can make it, so I hope you understand it. If you like the content, please press the like button. And I'm going to do much more work on 3D fluoroscopic wiring in the near future. So if you want to learn this technique, do subscribe to the channel. And I wish you the best of luck in wiring your CTOs. Bye-bye.